Understanding cancer. So we know a little about naming it and where does it come from or why it came about. And you now know a little bit about the generalities of how we treat it. Local therapy, systemic therapy, proven effective treatments, and new treatments. But what happens when you get in the room with the doctor and the doctor says something like, well, the risk of recurrence is going to be 85%, but treatment will give you a relative risk reduction of 40%, and the absolute risk of recurrence is 2%. Do you have any questions? That's not a helpful conversation in someone who's afraid of the word cancer. I try to get people just to say the word. You know, it's not, you only give it power if you're afraid of the word. I can think of a lot of words I'm more afraid of than the word cancer, but it's something that we all have to get past. So being in a room and talking about cancer and talking about recurrence, I get back to the idea of persistence. It means that there might be microscopic cells, and we need to talk about the chance that you're one of the people who has the microscopic cells. These cells have been there a while, and we talk about what can we do to reduce the chance of them coming back. We also talk about statistics. Now, there's a lot of people on the slide. Raise your hand if you're average. Anyone average? No, of course not. But we always report the average result. Well, the patients in our study lived an average of 10 years. Oh, the patients in our study lived an average of 6 months. The average response rate is 50%. What does that mean? Okay, you have to put it in some very simple terms. I didn't mean to give a lecture on statistics, but this is what's called the bell curve. And in a normal bell curve, it means that about 90% of us are going to get probably a B or a C on a test, okay? If you think about or how tall are all of the kids at any one school, or 8-year-olds? You're going to have some short ones and some tall ones, but most of them will be about a meter, okay? And that'll be the average. Next time I give this talk, I'm going to have a slide of Yao Ming, the Chinese basketball player, because he's so clearly not average. But he's just like one of us, so he's an exception. And an exception is exactly what you're looking for. We're not interested necessarily in the average when we talk to have a one-on-one with a patient. I'm interested in the way the curve is drawn here. It doesn't come down to zero. There's always a group that goes much longer. There's a group that doesn't follow the average, which means that some patients, well, we may say the average survival is 2 years, and that you might even say, if pushed, yes, it's sad, 90% of these patients have died within 5 years. I'm interested in the 10% of patients who are living beyond 5 years, and why? And can I help find that patient not after 5 years, but right up here at the very beginning? So how can we tell who's in the good group and who's in the bad group at the very beginning? Because if you ask me, doctor, what are the odds that I'm going to respond? My answer is always 50-50. You either will or you won't, okay? We can't know that ahead of time. I can tell you, out of 1,000 women just like you who have been treated on a trial, 90% of them respond. Okay, that's what happened in the past for 1,000 women, but I can't tell you where you are on that curve. Now, the next thing I can tell you is, if you do respond, if I do see a good result from the very first treatment, then I'm very likely going to put you way out here as somebody who gets better and is cured. But if I give you a treatment and I find that by PET scan or MRI or by physical exam, we didn't make a difference in the first 1 or 2 months, then I might say this is going to be a tough one, and we either need to change treatment or we need to change our goals. Maybe we don't talk about cure. We can't cure everything yet. That's an honest fact. But our goal is to make you live longer and live better, and that we can do very well. So it's important to understand statistics because no one patient is a statistic. You're a unique person. Statistics describe groups of people who came before you. And hopefully, you will be the exception where you can be in this skewed curve. You fall out to the side, outside of a normal distribution, because someone always does. I've said this already. Don't be afraid of the word. We lose our logical thinking when we're told we have cancer. I don't want to deny anyone their emotional needs. I don't want to tell you not to be afraid. But in the time that we have in a room, we need to be logical. We need to take a step back and say, here's what we need to do. Here's the plan. Here's the good part. Here's the bad part. Here's the hard part. Here's what we'll do if it goes wrong. Here's what happens if it goes right. Once we get that done with some clear thinking, then we can talk about the impact. Then we can talk about what does it mean for a spouse or a daughter or a son. So we don't want to ignore the emotional component by any means, but we do need some logical thinking. If somebody asks me, doctor, am I going to die? I universally tell them yes. My wife thinks I'm a terrible doctor because of that, but that's the truth. Raise your hand if you're going to die in the room. It's a guaranteed thing, okay? But the key is not to die of the cancer. The key is to make this a blip in an 80-year life, okay? To get this behind you and then worry about something else. You can worry about heart disease and bird flu and angry spouses and bad drivers, all right? But we want to make sure that cancer, when it happens, is addressed, is resolved, is that you're educated, and then we can get back to our lives. So that's the goal of the cancer doctors and the team at West Medical, is making you part of the team and making you educated about how we are going to think about this. Just a reminder, we treat for cure. When I look at patients, they come in and I say, this is a cancer we can cure. And I will be very aggressive. And I will make you jump through hoops because there are certain opportunities that we have to cure. If the cancer hasn't spread, if we've removed all the visible cancer and I'm giving you chemotherapy as a preventative, I'm going to be tough on you because this is the one chance for cure. And cure is important, as we all know. But cure is not everything. Cancer is also a chronic disease. We have, in the U.S., I just looked at the numbers before this talk, nearly 90% of the patients, for example, with breast cancer, are alive, of any stage, are alive 5 years later. And nearly 70% of all cancer patients in the U.S., of any diagnosis, all stages, nearly 70% are alive 5 years later. This is not a curse. This is not a death sentence. This is a chronic illness that sometimes requires aggressive therapy, sometimes requires a maintenance therapy, requires follow-up. But it's not always an immediately deadly disease. And as we treat cancer as a chronic disease, then we are going to have, as I said, more patients living with cancer. And we need to get away from the emotional aspects, because nobody says, oh my God, call my insurance agent. I've got diabetes. I have high cholesterol. Those are bad diseases too that lead to problems. But you say the word cancer, and then we have to pick you up off the floor and tell you it's not as bad as you think. So if we can do anything today and dispel some of the stigma and the myths about cancer and talking about cancer and sharing about cancer, then I think you've all taken a step in the right direction.